So these tissues vibrate and thereby causing a sound from the larynx. So, but why does this vibration occur is something that we need to understand. Doctor, can you just, this projector, can you just slightly to the side? I think the, yeah. Thank you, thank you. So why do these soft tissues vibrate? Okay, they vibrate because air is not going very smooth into the airway. Okay, there is some kind of turbulence that occurs in the due to some kind of an obstruction. I'll come this side so that fix it better. Okay, so why does this block happen? It is because due to some kind of obstruction. That obstruction can be partial obstruction or it can be complete obstruction of your airway. Okay, due to many factors. So normally when we sleep, you know, what we sleep in a supine position. Most of us, we sleep head down. Automatically the tissues relax. Our airway is mainly supported by muscles, and all these muscles relax. And generally, when we breathe, there is a negative pressure inside that brings these tissues together, right? And then the brain gives the signal, and then the airway expands. So that's how when we inhale, there's a negative suction pressure that comes in that brings these tissues together, which is more when we sleep. Okay, our muscles are relaxed, the CNS is relaxed. And that can partially block the airway in a relaxed state. So along with other factors, those factors will be seen. So if there is a complete blockage of the airway, what happens? It results in a condition called obstructive sleep apnea. Obstruction of the airway. It happens during sleep, and apnea meaning you're not breathing. Okay? So that is why this condition, the acronym is called, it's called OSA. So just see a small quick video about
When
this.
you breathe in, air flows in through your mouth and nose and down your throat, also called the pharynx. Air then flows down your windpipe or trachea, spreading through a tree-like structure of smaller tubes into your lungs. Each time you breathe in, negative suction pressure pulls the soft tissues in your mouth and pharynx inward. The muscles in your pharynx respond by pulling the soft tissues outward again, which keeps your airway open. When you sleep, it's normal for the muscles in your mouth, tongue, and pharynx to relax slightly, but not enough to block your airway. If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to reestablish airflow before falling asleep again. The cycle of apnea and waking up may happen many times at night, preventing restful sleep.
So you got an idea about what this problem is, right? In time of COVID, we all used to see oxygen saturation. Below 90 means immediately, oh my God, we're going for oxygen, this, that, But with this condition, your sats can drop down even to 70%, 65% every night when you sleep. Okay, so that's serious, this causes such a deficit that it can lead to stroke, can lead to silent heart attacks, so many serious problems. Most importantly, we are not fresh during the day. Okay, all the time we are sleepy. If you sit in a car, you fall asleep. You travel by, any metro, you fall asleep. If you're simply sitting and reading a book, you will fall asleep. Okay, so but just to get an idea about what this definition is, they say that if there is something called RDI, respiratory disturbance index, it's more than 5 per hour, it's called OSA. But in simple terms, it is the criteria to diagnose this is AHI. Okay. Why it is important to understand these things is there's more awareness regarding OSA amongst not only dentists, not all pulmonologists or not all ENT people are into sleep. Okay, so pulmonologists definitely for them this is there, but ENTs not all people are looking into sleep. So, but now more awareness is coming in. The Southeast Asian Academy of Sleep Medicine, which is headed by or founded by an Australian pulmonologist, basically an Indian, and then we have Indian Association of Surgeons for Sleep Apnea, in which you have ENT people, we have dentists, we have sleep specialists. So more awareness about this problem is coming. So they will be looking for dentists to treat with oral appliance therapy. And I'll tell you why oral appliance therapy in the coming slides. Not only that, if a patient comes to you,
We are missing out oral surgeons who are into this.
yes, oral surgeons, definitely. Really sorry, apologize. Yes. So, yeah, oral surgery is a little away from our general dentistry, so yes. In fact, that you mentioned, I was going to take up oral surgery, and one of my uncles is a very senior oral surgeon, Dr. Verghese Mani. Some of you have heard of him, he's an orthodontic surgeon. So I asked him, so he said, anyways, even after surgery, you have to do everything, so you take whichever you want. I ended up taking prostho because I didn't know much about prostho then. Anyways, so oral surgeons definitely, and we'll be seeing that why. So when patients come to us, or they, once more awareness is there, they will bring to you with some sleep report. So at least we should need to have an idea about what all of this means. And when we can give an oral appliance therapy, when we can't give an oral appliance therapy. Okay? So AHI is the scoring that is used to grade obstructive sleep apnea. Okay? It is the gold standard, you can say, but it's definitely not very accurate because newer parameters are coming in by research. So, but generally it is apnea hypopnea index. So what is this apnea meaning? There's 50% loss, complete loss of ventilation. You're not breathing for about 10 seconds. Okay? And hypopnea is with this 50% decrease in ventilation. So the number of apnea and the number of hypopnea divided by the total sleep time will give you the AHI. So if it is mild AHI meaning you have scores between 5 to 15. 5 to 15 in the sense, in an hour 5 means 5 times you're either not breathing completely for up to 10 seconds or your ventilation is 50%. So it is that much is mild. And we have moderate is 50 to 30 and severe is greater than 30. Okay? There is something called RERA, respiratory effort related arousal. I'm not going into that, but AHI is good enough. So it's a progression that can occur right from a simple snoring to hypoventilation. So what are the signs of obstruction that can now you understood that some obstruction is there, that is why this problem is there. So what are the signs of obstruction that can occur? So it can be multi, not just one obstruction. So let's start from the nose. How many of you have a deviated nasal septum? Okay. See, a few of us in this room already have this problem. Almost 70% of people with OSA